Good morning. I'm April from Complete Health Dentistry of Northeastern Pennsylvania. As we close Women's Health Week, we are here today with Dr. Mike Rogers to continue discussing heart attacks and strokes in women. Dr. Rogers is one of the first dentists in the country to graduate and earn certification in the Doneen medical method, and today we have a very special guest speaker, Dr. Amy Doneen, who's joining us again this week to speak about women's health. Dr. Doneen is the co-founder of the Doneen method. She's also an international speaker on health, wellness, and heart disease, stroke, and diabetes prevention. She is also the founder and medical director of the Heart Attack and Stroke Prevention Center in Spokane, Washington. She's an adjunct professor at Texas Tech Health Sciences School of Nursing, a clinical associate professor at Washington State University College of Medicine, and also an assistant professor at University of Kentucky College of Dentistry, and most importantly, the co-author of the bestseller Beat the Heart Attack Gene book. Welcome, Dr. Doneen.
Welcome back, Amy. How was your Mother's Day?
April. Thanks, Mike.
How was your Mother's Day last week?
It was lovely. We had our oldest daughter graduate from college, so I can't believe that happened so quickly. So it was a very special Mother's Day.
Yeah. How exciting.
Exactly.
Yes.
We're just going to delve right into this because we've got a lot of people interested in what we talked about last week, and they're clamoring to get back and get more information on this today. Where we left off is you were discussing, if we can kind of recap what we talked about last week a little bit, maybe would be the best, that vascular issues, or women are underdiagnosed with vascular issues, heart attack, stroke, and there's systems out there. Yours in particular, the Doneen method of evaluating for vascular changes, can evaluate for someone who has risk factors for heart attack and stroke, because many of those risk factors you go unnoticed. And since it's women, they seem to be underdiagnosed as well. Is that a fact, or?
It is a fact, Mike, and there's lots of reasons for that. A lot of women are not picked up with the standard risk factor scoring tools. And as I mentioned last week, and I want to reiterate, 64% of women who die suddenly of a heart attack are walking around with plaque in their arteries, and they do not know it. The time has come that has got to change. There are testing, we discussed that last week on your show, that women can find plaque in their arteries. They just need to be advocates and ask for that. There are also, and we mentioned this briefly, and to April's question last week, what should I ask for? How do I know if I might be at risk for a heart attack? In our book, we discuss some very common we call them red flags. And Mike, red flags mean there's not a cause and effect. I'm going to give you an example. Like if a woman has a history of migraines with aura, do you know that she's at an increased risk later in her life to deal with stroke? Well, do you know that women who have pregnancy complications, things like gestational diabetes, polycystic ovarian syndrome, preeclampsia, even have delivery of low birth weight or preterm infants, those women are particularly vulnerable to other issues that might place them at increased risk later in their life for the development of plaque in their arteries. So in our book, we mention lots of red flags, and I want women to be educated. The one that's probably the most big overriding is one that has to do with autoimmune inflammation. So women with rheumatoid arthritis, women with lupus, women with psoriasis are particularly vulnerable to the 60,000 miles of highways in our body to also be inflamed.
That's a lot. I've got what came to mind is you had mentioned a lot of these things at birth or childbearing years can predispose someone years down the line. Is that something that can be checked or looked at? Say if someone had a preterm a low birth weight baby or preeclampsia, is there a window that they should be checked afterwards, after having the baby preterm or having preeclampsia?
Oh, that's such a great question.
Then where else down the line do we need to look at?
Yeah, really great question. It is recommended and rarely done that women who have complications during pregnancy, let's use that as our example right now. Women who have complications during pregnancy, it is formally recommended that they be checked 3 to 6 months after delivery for vascular inflammation and vascular consequences. And the reality is, if we find out early, we can prevent negative outcomes down the line. I also want to say that not all women with preeclampsia, low birth weight babies, gestational diabetes, PCOS, are going to have a heart attack. I'm not saying that, but they're at increased risk. Mm-hmm. And so that's why I'm just so, as you can tell, I get quite passionate about women being educated and being their own advocates. To get checked out and find out if you have vascular inflammation and find out if you have plaque in your arteries.
Now, I'm kind of changing tack here a little bit. Last week we discussed how the mouth can relate to vascular inflammation. The bacteria in our mouth can increase cholesterol accumulation and can create our body's response, which can produce thrombi or thrombosis. And how does that affect? I know I advocate for patients that we're not just based on an insurance model where everybody comes in twice a year regardless of the health of their gums. It's based individually on what we see. How is the bacteria in the mouth affecting the health of the body in that respect? And then what actually is it? I've mentioned the term thrombus. What actually is a thrombus and plaque in the artery? Because we get plaque in our mouth. What's plaque in the arteries?
Yeah, good question. So a couple things on that. What people need to understand is that when we use the word plaque in the arteries, it's a word overused in health, right? Plaque on the teeth might represent biofilm on the teeth. Plaque in the arteries represents an inflammatory oxidative process where cholesterol and collagen are being collected in the artery wall. So not to get over complex, but what I want people to understand is what causes a heart attack or stroke. Why is someone fine on Monday and not on Tuesday? What happens is we can walk around for years with plaque in the wall of the artery or a thickness. Think about it like inflammation in the wall of our artery. And if it's not addressed, that inflammation can cause a rupture through the very thin inside lining of the artery. And when that happens, Mike, the body's natural response is to form a scab or a clot or a thrombus, no different than if you cut your skin. You're going to form a scab. But the reality is these vessels are very tiny. So if that scab or thrombus blocks the flow of blood in the heart, we call it a heart attack. If it blocks the flow of blood in the brain, we call it a stroke. If someone doesn't have a heart attack or stroke, they're also susceptible, if they're walking around with plaque in the arteries, to deal with diseases of aging, like dementia, microvascular dementia, to peripheral arterial disease. So we advocate with the Doneen method that even those diseases of aging can be prevented. There's just no question about that.
We're here with Dr. Mike Rogers and Dr. Amy Doneen discussing women's health as it relates to heart attack and stroke. When we come back, we will talk about warning signs and the difference between red flags and root causes.
Complete Health Dentistry.
Healthy teeth and gums for a lifetime? How important is it? At Complete Health Dentistry of Northeastern Pennsylvania, that is our focus. If your mouth isn't healthy, your body can be affected as well. Gum disease has been linked to heart attacks, strokes, and diabetes. And if your teeth and gums are in bad shape, it affects your ability to smile, eat, and live life to the fullest. You've worked hard. Isn't it time to take care of yourself? Turn to Dr. Michael Rogers at Complete Health Dentistry, where you and your health are our number one focus. Take time for your health. Call Complete Health Dentistry at 253-5000 and schedule your new patient experience today. See how we can help you feel and look better than you ever thought possible.
Complete Health Dentistry. Transforming your health for a lifetime.
Visit us on the web at CompleteHealthDentistry of NEPA.com. Welcome back as we continue our discussion with Dr. Amy Doneen. Amy, so are there any warning signs that this plaque is growing in your arteries?
Yeah, that's a good question, April, and that's $1 million question. The answer, unfortunately, is no most of the time. The plaque that lives in the wall of the artery, April, is usually silent until it's not, and that's why this disease is so sneaky. So it really, I want to think of an example. So if we have something going in our body, usually we don't feel it until it's large enough that it causes symptoms. So oftentimes, the medical system right now is based on an end stage disease paradigm. If something's broke, we're going to fix it. If there's a blockage, we're going to open it. So, stenting, coronary bypass grafting, all of those are life-saving, there's no question. But wouldn't it be nice, April, to know if you had plaque in your arteries,
Absolutely.
identify the why, treat the why, see it stabilize, and never have to go in for that type of end-stage disease care?
Now, Amy, one of the questions I have that came to mind was, in your book, you talk about red flags and root causes. Red flags you had kind of discussed somewhat with as it being, say, a warning sign that you could be predisposed or have this come in the future, such as, say, rheumatoid arthritis, low-term birth weight and premature birth weight babies, diabetes, things like that are also systemic. But what's the difference between your definition of a red flag and a root cause? Is a root cause something different than a red flag?
Yeah, great question. So root causes are diagnosable conditions that have proven to be causal, meaning if you have one of these root causes and you treat it, the vessels will improve. As an example, things like prediabetes. When individuals have prediabetes or insulin resistance, if we tackle the insulin resistance, not only can we prevent diabetes, but we can prevent plaque growth and plaque inflammation. Another example would be nicotine. That's a root cause, not just a red flag. If we remove the nicotine, the arteries get healthier. Sleep apnea, vitamin D deficiency, genetically inherited lipid abnormalities that affected Bob Harper, who was the trainer on The Biggest Loser recently. These people that are healthy and drop of a heart attack. Unfortunately, lipoprotein A is not part of the guidelines, so we've assessed for that for the last 18 years in individuals. So these things that are out there and available, we advocate to get assessed completely so you know what your risk is.
Okay, fantastic.
Now, Amy, in our office, we have patients that come in that have had heart attacks, and they're believing that they're cured because they had a stent or the bypass surgery and so forth. Is this true?
Well, their life was saved. That is true, and it's wonderful. And the cardiologist that placed the stent or did the bypass, the surgeon, they did save that individual's life. But here's the challenge, April. Our vascular system is immense. So think of miles and miles and miles of arteries. And if we fix 2 inches of a large highway system and don't identify why they had that event in the first place, the disease is going to continue to smolder on. And that's why recidivism, like a revolving door, these people who have a stent and then 3 years later go in for another, and how tragic it might be that these patients, they may have now their cholesterol treated and their blood pressure treated and their stent in place. But if they're walking around, just as an example, with gram-negative periodontal pathogens that no one has assessed and no one has treated, that disease is going to smolder. And they're going to have problems down the line. So are they cured from death? Yes, which is wonderful at that moment, but are they cured from having other events? Not really.
So it amazes me that you said a bypass or a stent is going to address 2 inches or so of that area of the vasculature, whereas I think last week we talked about that we've got 60,000 miles of arteries in our body. So I mean that's like a bazillionth of a percentage. I mean that's minimal compared to what actually is going on. So if there's plaques or buildup, say where they did the stent, somewhere else in the body there's going to be plaques and buildup as well, because it's not just located to that one spot.
Yeah, atherosclerosis is a systemic disease. So even for people that have regional disease, like just in the heart, which can happen, if it's not addressed as a systemic problem, they're left vulnerable for diseases of aging that are affected by plaque, like vascular dementia, like eye diseases, like chronic kidney disease, like congestive heart failure, peripheral vascular disease. The body needs blood flow. And if those arteries that feed all of our organs with oxygen are blocked in any microvessel form, some are no bigger than a human hair. And if those are blocked, you're not going to feel it until you have the symptom of memory loss. And so it's really important that we advocate for, one, finding out, do we have plaque anywhere? And if we do, find out why, treat the why, see the inflammation go down, and see the disease stabilize. Not just assume we're okay until we're not.
Fantastic. Amy, I've got one last question, and then we'll move on. We talked about root causes this morning, and in your book, there's like 20 root causes and more being found all the time. Is if you cure one of those or address one of those root causes, does that eliminate all the others? Or the more of those root causes we address, like gum disease and decay in the teeth and tooth infections and things like that, cholesterol and high blood pressure, does it take, the more we do it, the better off the patient is, or is just one enough?
Yeah, great question. So there are a lot of root causes, and it would be impossible to place one above the other as far as importance. What we like to do with our method is, I say to patients, I want to lay all the chips on the table. I want to know why you have plaque. It could be lipoprotein A, could be periodontal pathogens, could be an infected old root canal, could be systemic inflammatory autoimmune diseases like gut dysbiosis or rheumatoid arthritis. Could be low vitamin D, obstructive sleep apnea, psychosocial issues. I could go on and on. We find out why. We treat the why comprehensively with a lifestyle and precision-based genetically guided medication program and lifestyle program. We monitor the inflammation to know that the treatment is working, and we move forward. So it's a very different approach. The standard of care is going to focus on blood pressure and cholesterol. And if those are fine, the assumption is that an individual is fine. Well, what you'll realize with your listeners who actually look at our book and understand our method is they could have inherited risk factors that quite honestly are missed by the standard of care. And I want to, if I may, just tell your listeners how fortunate they are to have you, because, when we started educating the public and both the dental providers and the medical providers about heart attack and stroke prevention through our method, which is a disease inflammatory paradigm versus a risk factor paradigm, people, especially in dentistry, wondered, who are these people? Why are they talking about this? And there was a very select group of individuals around the country that I just feel so respectful of, and Mike, you're one of them.
Well, thank you, Amy.
You, Dr. Mike Rogers, were one of the first individuals to actually come to a medical course talking about heart attack and stroke prevention. When patients come to Complete Health Dentistry of Northeastern Pennsylvania, they are walking into an environment that recognizes the importance of oral health as it relates to their heart attack and stroke risk. So I just want to unprovoked, just tell your listeners how lucky they are that the expert in the nation really are right there. You do things to look for these pathogens. You pull out a microscope and show them that they've got these pathogens. You are unique. I hope that you become not unique and that everybody practices the optimal type of dentistry that you do. But boy, your listeners are really fortunate. And if I had any red flag, if I had a family history of heart disease or stroke, if I had any known medical risk, I would not walk to your office. I would just run to your office and get there as soon as possible, because if you miss the oral systemic connection, no matter how pretty your cholesterol is, no matter how pretty your blood pressure is, you could still have vascular inflammation. So huge thank you to you for your work. You are a national expert, and it's a real honor to work with you.
Thank you, Amy. You're making me blush. But for all you listeners out there, if you want to be more involved with your health, give our office a call, 253-5000, or at Complete Health Dentistry of NEPA.com.
When we come back, we will wrap up our discussion with Dr. Amy Doneen on women's health. Uninterrupted, unhurried attention? Time to talk about your health, your smile, and how they affect you from head to toe? If stress-free dentistry is what you are looking for, visit Dr. Michael Rogers of Complete Health Dentistry of Northeastern PA. We believe your mouth is a gateway to overall health. Complete dental health is the first line of defense against many diseases, including diabetes, heart disease, and cancer. In his state-of-the-art practice in Honesdale, Dr. Rogers offers the care you need to look and feel your best. From preventive care to implants, sleep apnea, and sedation, this is the premier dentistry you deserve. Call Dr. Rogers at 253-5000 and schedule your appointment. Just one rejuvenating visit and you'll be spoiled.
Complete Health Dentistry. Transforming your health for a lifetime.
Welcome back. This is April from Complete Health Dentistry. I'm here today with Dr. Amy Doneen of the Doneen Method and Dr. Mike Rogers, a graduate of the Doneen Method. Doctor, in our earlier discussion, you both talked about gram-negative periodontal pathogens. What is that?
Well, April, that's a great question. What it is it's a bacteria in the mouth. What causes gum disease, bone loss, and what we're finding in more and more of these medical studies, how it's relating to heart attack, stroke, diabetes, increased medical problems.
So just looking in the mouth, you can see these bacteria? Or can you tell there's inflammation or periodontal disease?
In some instances, you can look in the mouth and see swollen and puffy gums. And that's an indication there's something going on underneath. Our body's trying to fight this bacteria that we see, and that's a visible sign. But on the other side, what happens is many times you can look in the mouth and it looks perfectly healthy and it looks nice and pink and it doesn't look like there's any swelling. But you go below the gum line, you touch the gums or in between the teeth with toothbrush or floss or things like that, and you'll get some bleeding. And some people, other people who smoke or take some medications may not bleed at all. And so it's tough just to look in the mouth and go, oh, you're perfectly healthy. I use the example of it's like looking at a pond. When you look at a pond, it looks like a nice, flat, smooth surface. But underneath, you can't tell if there's rocks or boulders or logs or anything, glass or anything like that. And so what we're doing is when we're evaluating people for gum problems and this bacteria, we're looking at bacteria on a microscope slide. We're looking at bacteria that we send out to actually be tested to find out the type of bacteria and how bad they are. And then also we're checking to see if it's already caused bone problems or shape changes to the bottom of the pond, so to speak.
So bone changes in the mouth you're talking about?
Correct. Bone changes in the mouth is an indication that your body is really aggressively fighting this. And along with the bacteria, the byproducts of the bacteria, it's causing bone loss, which cause tooth loss, tooth sensitivity, and a whole host of other medical problems now.
Wow. That is like the iceberg in the Titanic, isn't it? Exactly. And earlier, you both talked about having great cholesterol and blood pressure levels, but there was something that you mentioned that I didn't quite understand with the cholesterol.
You know what that is it's probably that lipoprotein A.
Yes.
And what that is one of the things that usual blood tests look for are the amount of cholesterol in our system, the LDLs, the HDLs, the triglycerides. But one of the biggest markers for systemic or total body inflammation that is driving a lot of these major diseases is the lipoprotein A. And that's one of Dr. Doneen's red flags. You know, it's a red flag that we need to be looking at this. There's tests out there run by our hospital here in Honesdale is a collection center for the Cleveland Heart Lab. And they routinely do tests like that where they look for systemic inflammation. In fact, the panel of blood work that Dr. Doneen and her partner Brad Bale do is run through the Cleveland Heart Lab.
Interesting. And we have that right here in our backyard. That's pretty cool.
It is.
So another thing, Dr. Rogers, at our office, I know we check blood pressure on every single patient every single time. And sometimes that upsets our patients because they feel that their physician checks that. Can you explain to our listeners, why do we take blood pressure on every patient every single time?
Well, I believe that it's part of good health. One, we're screening for patients that can be undiagnosed high blood pressure problem. We're also checking, if you are on blood pressure medications, how well is that medication working for you? Is it able to control your blood pressure to where it should be? And also, if we're using anesthetics, then that can also raise blood pressure. So we need to evaluate this. Just, we routinely hear, oh, I've got white coat syndrome. We don't wear white coats in our office, but still. And yeah, that's something your doctor can evaluate, but it's just, we're screening for it, we're evaluating it, we're partnering with your physicians to make sure you're in tip-top optimal health.
Okay. And also, our patients do come to us at least twice a year, if not more. And I know it's recommended that we see our physicians once a year for our annual checkup, but I know not everybody does that. So these are things that you can catch, that it may be a warning sign, and we can send to the physician. Is that correct?
Correct. Our goal is to partner with our physician allies, so to speak, and keep you as healthy as possible. My goal is, one, to do everything I possibly can in the scope of my practice to keep you healthy and to eliminate the problems from the mouth, or things that, because we do see our patients more frequently than other medical practices. And so we want to be on top of things. We don't want to be reactive, waiting for something to happen. We want to be in front of it and catch it before it becomes a bigger issue.
So we're proactive with our patients' care, just like we're with their medical care, just like we're proactive with their dental care.
Correct. Exactly.
Okay.
Amy, I want to take the time to thank you very much for joining us these past 2 weeks and educating all of the people of northeastern Pennsylvania. I mean, taking time out of your busy schedule for us. I want to thank you very much for that. April, thank you for joining us as well.
You're welcome.
Thank you both, and April and Mike. Congratulations on your work. You are saving lives every day in your dental practice, and I couldn't be more honored to be here. And again, to the listeners, if you have the opportunity to see Dr. Mike Rogers, please do so, because he looks at the mouth as it relates to the systemic system. And for those of us in medicine, we thank you, Dr. Rogers, for your life-saving work. Thank you.
Thank you, Amy.
Complete Health Dentistry, transforming your health for a lifetime.
The days are getting longer, the snow is finally melting, and now it's time for a good spring cleaning. At Complete Health Dentistry of Northeastern PA, Dr. Rogers reminds you that a professional dental cleaning is imperative to your overall health. Did you know that 8 out of 10 people have gum disease? 50% of all heart attacks are linked to gum disease, as well as stroke, diabetes, Alzheimer's, pancreatic cancer, arthritis, and pregnancy complications. At Complete Health Dentistry, you will receive many life-saving screenings to keep you in tip-top shape and decrease these potential medical complications. We want our patients to enjoy a long, healthy life with minimal medical issues. Regular dental visits will help you maintain healthy teeth and gums and help prevent serious health conditions. Take time for your health. Call 253-5000 and schedule your spring cleaning today.
Complete